Hi guys, welcome to Overcome Sciatica. My name is Will Harlow, sciatica specialist behind Overcome Sciatica. First of all, I'm going to apologise for my voice today. I've been losing it for the last few days, so if I go a bit croaky, just bear with me. So you're probably joining me for the first time today, which is absolutely fantastic, and it's likely that you've suffered for a while. Most of the people that come to see my work at Overcome Sciatica have suffered for longer than a few weeks, and they're really getting sick and tired of their problem right now. They're fed up of the back pain and the pain down the back of the leg, and they want something they can do that can fix it, which is completely different from what your doctor likely recommended to you, which is usually more painkillers, just rest it, or go and have a walk around the block, which is what most people get as advice, which quite frankly is crap and not really good enough. So what I want to do today, rather than go right into sciatica, is just give you 3 stretches you can use today that should help to relieve some of your sciatica pain and also pain from piriformis syndrome, which is slightly different. If you're not sure what these problems are, then sciatica is most commonly caused by a disc bulge in the lower back, and it causes pain right down the back of the leg, sometimes just in the calf, sometimes just behind the knee, but often it goes all the way from the lower back right down into the toes, so it's a really unpleasant condition. Now, piriformis syndrome also causes a similar type of pain, but the origin of the problem is in the buttock rather than in the lower back, so that's the main difference between the 2 problems. We're going to treat them in a similar way, so don't get too hung up about whether it's a disc bulge, something called spinal stenosis, or piriformis syndrome causing your sciatica, because we're going to treat it in a similar way. So let's have a look at these stretches. If you'd like more information about sciatica or piriformis syndrome, head over to the blog on howtogetridofsciatica.com, head to free expert information, and you'll find tons of expert articles which can help you work out what's causing your problem, what to do about it, what to avoid, and your next steps for getting better. So let's dive into the exercises. Now, the first exercise we're going to do is called the standing piriformis stretch. So this is one you can use even if your problem is caused by a disc bulge, not just piriformis syndrome. It's going to help with both problems. So the way you're going to do it is you're first of all going to assess both sides, and you're just going to do the exercise on the side that feels easiest. I'm just going to explain now. So you want something to hold on to, okay? So let's first of all imagine that your sciatica is in this side on the left. So what you're going to do is you're going to hold on to something with your right hand, and you're going to put your left leg up like this, just above your right knee, okay? You want your knee to be rolling out, so you should be in sort of a figure 4 shape like that. What you're then going to do is you're just going to bend the right knee, and as you do that, you're going to stick your bum out at the back and lean forward, and as you do this, you're going to feel a stretch in that left side, and then you're going to come out of it. So you're going to do that again and come out, and again and come out, okay? Then I want you to try it on the other side. So again, into the figure 4 shape, bend the knee, stick the bum out and back up. Bend the knee, stick the bum out and back up. So we're not flexing the spine like this, okay? We're sticking our bum out and keeping our back straight so as not to irritate any existing disc bulge, okay? After you've done 2 or 3, just feel which side felt easiest, and you're just going to do the exercise on that one side. And the way you do the exercise is exactly how you tested it, but you're going to do 10 in a row, okay? So let's say it was this side that felt easier. I'm going to stick it like this, figure 4 shape, forward and lean, bend the knee and stick the bum out, bend the knee, stick the bum out, bend the knee, stick the bum out. I'm going to go all the way up to 10. And you should feel as you do 5, 6, 7, you can actually bend a little bit further because things will start to loosen. That's a good sign, okay? So just go with it and just push it until you get to that stretching point. I want you to do 3 sets of 10 repetitions just on that one side and see how you feel. Okay, for this next exercise, you're only going to perform it on one side, and that is the side that doesn't have sciatica in it. If you're suffering from sciatica in both legs, just pick the one that is least painful, but if it starts to make it worse, then you need to stop, okay? There's no point trying to push through it. So for this one, what we're going to do is we're going to try and stretch off the hamstring and also get a little bit of rotation in the back too. Both of those things should help your pain settle down a little bit. So I'm just going to demonstrate to you now what this exercise looks like, and let's pretend that this left leg is the one with the sciatica in, okay? So we're not going to use the left leg at all, we're going to keep the left leg nice and bent as it is. So you're going to start off by extending the right leg. So the right leg's nice and straight. You're going to put your right hand just on your right thigh. So if you look at the way I'm sitting, I'm quite upright, I'm not hunched forward, I'm upright, okay? So my back's nice and straight. But you still want to be comfortable, so just have a wiggle, make sure everything is nice and relaxed. Don't want to be too uptight for this one, okay? So this is the painful one, this is the one that we're going to be working. So it stays straight, let the foot do whatever it wants, okay? You're going to have your hand just on your thigh here. All I want you to do is lean forward and rotate, okay? So you're going to lean forward and rotate to the left and come back. So as soon as you feel a stretch in this right leg, come back, okay? Forward and back. Can you see how I'm rotating my upper half slightly as well? And that's quite important because that gets a little bit of movement into the spine, and you'll also feel that you'll probably be able to take your hand a little bit further down the leg each time you do it. So again with this exercise, I want you to repeat 10 in a row, just on this side. You're not doing it on your painful leg. Obviously, if your right leg was the painful one, you would extend the left like this. The hand would be on here, and you're rotating, okay? Sorry, you'd be rotating away like this. Away. Away. Away, like that. So the hand slides, and you rotate to the right. Okay? 10 repetitions on the one side that isn't painful. Stop, have a break, repeat that 3 times over. For the final exercise in this short video, I'm going to show you how to stretch the hamstrings in another way that also helps the nerve move better. Again, we are only stretching the side that isn't painful, so you're going to leave the painful side alone. So again, for this example, I'm going to say that my left leg is the painful one, so that one's just going to stay where it is. I'm going to take my right leg and I'm going to bring it up like this. So you want to be nice and supported. If you extend your elbows, you can completely relax your back and you can just lean back by using the grip in your hands, and you can almost rock, and it shouldn't be painful on your back at all. So you should be nice and comfortable from this position. I don't want you to try and sit upright too much, okay? Just relax, nice and rounded, a nice relaxed posture, so we're not trying to force it too much, okay? All you're going to do from this position is going to pull your leg up, lean back, and you're just going to extend like this. And remember, this is your comfortable leg, it's not your painful leg. As you do this, I want you to make sure your chin doesn't drop down, okay? It's very important. The reason I say that is because if we do that, it puts tension on the entire neural pathway. So your brain, your spinal cord and the sciatic nerve gets tight when we drop our chin to our chest. So we want to keep our chin up as we do it, okay? 2, 3. As you extend, you'll probably feel that you get a little bit of tightness in this leg, and that's normal, okay? So that's not harmful. And you're only going to extend it to a point where you feel comfortable. You're not going to try and fully straighten it if it doesn't come naturally to you. So for this one, you're going to do 20 in a row. And then relax. And you're going to try and repeat that 3 times over. Again, remember, just on the comfortable side, not on the painful leg, okay? If your other leg is painful, then you're going to swap it over. So it would look something like this. Nice and relaxed to start off with, lean back. Chin up, 3, 4, 5, 6, 7, 8, 9. You get the idea. All the way up to 20 if you can. Have a break, maybe a minute, and then back into it 3 times in a row. And that's it. Okay guys, I hope you enjoyed that video and that you've learned a couple of techniques that you can use for pain relief from sciatica and piriformis syndrome, and hopefully these techniques will start to work quickly. So if you start to feel relief in the first few days, then that is absolutely fantastic. The only thing is, obviously these exercises aren't going to fully fix your sciatica, okay? They're just to help to balance the pelvis, loosen off some muscular tension, and should make you feel a little bit more comfortable. If you'd like to see more about techniques you can use that will actually facilitate a full recovery, then head over to my website, howtogetridofsciatica.com, and have a look at some of our treatment programs there. They're the best way to keep improving, to push yourself on, and to get the recovery you want and deserve. So if you don't want to sign up to a program, that's absolutely fine. We also have tons of free expert information that I've already mentioned to you. And over the course of the next few weeks, I'm going to be sending you plenty of great information in your email inbox, all for free. So keep an eye out for that as well. Anyway, thanks for joining me on this video, and I hope the video helped, and I look forward to hearing your recovery story soon.